So a bunion is a common foot condition that involves separating of the first and second metatarsal of the foot, causing an enlargement of what's called the medial eminence of the first metatarsal head, which is actually that bump you see on the side of your foot. It is treated by using some wider shoes, orthotics, sometimes bunion pads or splints, and sometimes people go on to surgical correction of the bunion. That involves shaving down the bone or the first metatarsal head and possibly cutting the bone, moving it over, and placing a screw across it to hold it in place to correct the alignment and position of the toe. The surgical recovery involves usually around 8 to 12 weeks depending on the type of procedure that's performed. There are certain procedures and things that can be used, such as pain pumps after surgery, that can minimize your pain to help for a pretty pain-free surgical procedure. Although no surgery is pain-free, it can definitely help to reduce your pain to 90 to 95% of being pain-free, along with medication that can help you to be comfortable afterwards. It does involve being in a special shoe or boot afterwards, so it's minimal kind of weight bearing. So you know, some procedures do involve being completely off your foot, but most bunion procedures can be done with a minimal heel weight bearing situation, protected in a surgical shoe or boot, and then getting you back to kind of recovery and back on your feet within 6 to 8, sometimes up to 12 weeks, depending on what's performed.